According to the United Nations Program on HIV, an estimated 35.3 million people were living with HIV in the year 2012, which records an increase from previous years, as more people are receiving the life-saving antiretroviral therapy that reduces the incidence of relapse to AIDS. There was a 33% decline in the number of new HIV infections from the year 2001, which records a 3.4 million new infection, to the year 2002, with 2.3 million new infection. Whereas the number of AIDS deaths also shows a decline with 1.6 million AIDS death in the year 2012 from 2.3 million AIDS death in 2005. Out of the HIV-infected people, the vast majority of them comes from middle to low-income countries, particularly in sub-Saharan Africa, as shown on the world map on the bottom right. However, the new HIV infection has shown a gradual decrease from the year 2001 to 2012, as shown on the graph on the lower left. According to the United States Department of Health and Human Services, approximately 10% of the people with HIV are children, whereby most of them are infected by their HIV-positive mothers during pregnancy, childbirth or during breastfeeding. The trends of HIV cases in new adult infections differ among geographical regions. But out all the regions, the epidemic continues to affect sub-Saharan Africa the most, with 70% of all new HIV infections in the year 2012. However, the annual number of new HIV infections among adults has seen decline by 34% since 2001. The most distinct decline in new infections since 2001 to 2012 occurred in the Caribbean with a 34% reduction. New HIV infections was on the rise in Eastern Europe and Central Asia in recent years, while in the Asia and the Pacific, new HIV infection shows a 25% decrease. In Latin America, new cases of HIV remains constant. In contrast, new HIV infections continue to rise in the Middle East and North Africa. The significant declines in high-prevalence countries like Zimbabwe might be attributable to the change in sexual behavior, such as the delayed sexual debut, high levels of condom use and reductions in multiple partners. Other countries that recorded a higher than 50% reduction in HIV incidences are the 26 countries listed below. According to the Disease Control Division of the Ministry of Health Malaysia, the incidence rate of HIV cases in the year 2013 was about 11 incidences per 100,000 population, with a mortality rate of 0.58 per 100,000 population. On the other hand, AIDS recorded an incidence of 4 per 100,000 with a mortality rate of 1.62 per 100,000 population. With that being said, new HIV cases were shown to be on a steady decline over the past decade, as shown on the graph below. The World Health Organization estimates that 10.3 million youth aged 15 to 24 years are living with HIV and AIDS, and half of all new infections are occurring among young people on a global basis. It was speculated that most of them were not aware that they are infected. Each year, about 4 million people younger than 20 years are diagnosed with sexually transmitted infections, including herpes, human papillomavirus or HPV, chlamydia, gonorrhea, and the HIV. While in Malaysia, males accounted for 90% of the cases, as shown on the graph on the top right, but the epidemic began shifting its trend, as shown by the male-to-female ratio of 10:1 in 2002 to 4:1 in 2013. By ethnicity, 70% of all infections are by Malays, followed by the Chinese, Indians, and others. In the span of the year 2005 to 2013, the number of HIV cases by sexual transmission tops the transmission by injection between drug users. This shows that lifestyle plays an important factor in understanding the route of transmission too. Other than that, heterosexual contact is the main risk factor for HIV transmission in the year 2013, followed by homosexual and bisexual contact and injecting drug users. The clinical features of HIV infection leads to a disruption of the helper T4 immune cells by the virus, which results in an increased susceptibility to opportunistic infections. This leads to the breakdown of the body defense system, and the range of symptoms produced following is called the acquired immunodeficiency syndrome, or AIDS. AIDS is generally presented as the symptoms of various opportunistic infection. Initially, there may be an acute retroviral infection with fever, sweating and myalgia, but after this subsides, there is a dormant period for months or years, after which symptoms of an opportunistic infection occur. Any process that stresses the immune mechanism, such as repeat infections, will accelerate progression to AIDS. For example, tuberculosis is affected by the disruption of the immune process. Therefore, the people with tuberculosis who contracts HIV infection will progress more rapidly. Without treatment, HIV advances in 3 stages, which is acute HIV infection, clinical latency, and AIDS. However, antiretroviral therapy helps to control the virus, and thus prevent HIV from progressing to AIDS. People living with HIV may progress through these stages at different rates, depending on a variety of factors, including their genetic makeup, how healthy they were before they were infected, how soon after infection they are diagnosed and linked to care and treatment, whether they see their health care provider regularly, and take their HIV medications as directed, and different health-related choices they make, like diet, exercise, and lifestyle habits. HIV can be transmitted through sexual contact, infected blood, used syringes, or from mother to child. The incubation period from the start of HIV infection to AIDS can be as long as 1 to 18 years. The infectiousness is highest during the initial infection, and whenever the immunity is suppressed. Individuals who are undergoing treatment have a longer life extension, and hence, the increased period of communicability, but with a diminished virus shedding. The World Health Organization set the guidelines for method of diagnosis based on 2 groups, which are the countries with full diagnostic facilities, such as serological test, and the countries without full diagnostic facilities. For the countries that lack the diagnostic facilities, their guideline includes the case definition for HIV infection and AIDS, based on the major or minor signs present. Here is an infographic from the United Nations Program on HIV that identifies the 12 populations of people that are at highest risk of infection, but are apparently being left behind, for reasons like not being aware or not having the correct knowledge of what HIV is, fear of social stigma, not having the access to therapy, or not protected by law or certain policies.
Alright, so that's about it for my seminar on the epidemiology of HIV infection. Do you guys have any questions?
Yes. Actually, what do you think, let's say, what will happen if an effective intervention is not found in HIV?
Since HIV infection has such a long incubation period, the epidemic might last for around 100 years if an effective intervention is not found, I would say.
Okay.
Alright, Vinny. Which age group does new cases of HIV predominantly occur?
From the data from World Health Organization, it states that new cases occurs mostly in young adults, like in our age.
Okay.
How can HIV can actually be transmitted in regards to mother to the child transmission?
In regards to mother-to-child transmission, they can be transmitted within the uterus to the fetus, during delivery, and during breastfeeding.
Generally, what are the main risk factors for HIV infection?
Again, according to the World Health Organization, it's mostly through unprotected sex, unsterilized needles among drug users, and having multiple partners at the same time.
Maybe I have one more question. Yes. Do you know what is the average time of infection for HIV to the development of the AIDS?
It usually falls in the range of 1 to 18 years, but the main value for the time would be 10 years. Again, on data from